If you have silver fillings in your mouth, will you get mercury poisoning? Mercury toxicity is a serious topic, and it should not be taken lightly. In this video, I'm going to share with you some things that you should be aware of if you are someone who has a silver filling in their mouth. At the end of the video, I'm going to share some tips for patients on how you should go about receiving your dental care. And for dental providers, I'm going to share some things that you can do to limit the exposure of mercury to yourself, your team, and your patients by using the SMART protocol. Hi, I'm Dr. Ravi, a retired dentist turned entrepreneur. First, let's talk about some eye-opening facts. Did you know that dental amalgam, the silver filling in your mouth, contains around 50% of elemental mercury? This type of mercury can release harmful vapor. However, most of that is happening when the filling is being placed or removed. In a study done by Dr. Rubina Mumtaz, which is found on the United Nations Environmental Program website, had the following findings. After 20 years of research, no solid evidence has pointed to mercury toxicity due to only amalgam fillings in the mouth. However, majority of the studies have shown that occupational exposure to amalgam is a leading cause of mercury toxicity in dental professionals. Scandinavian countries like Sweden, Norway, and Denmark have implemented policies to phase out amalgam, but the World Health Organization, the American Dental Association, and the US Public Health Commissions and CDC have allowed the use of amalgam, but only with strict implementation of amalgam waste management protocols. Before we go pointing the finger at dentists using these silver fillings in patients, let's dive into what mercury poisoning actually is. Mercury is a toxic substance that can be harmful to our bodies in large quantities. Exposure to mercury vapors from dental amalgams can lead to a range of health issues. But what about dental amalgam themselves? Dental associations often assure us that the use of amalgam is safe while it's in the mouth. However, there are mercury vapors that are released during the placement and removal of amalgam fillings. And this is why many health-conscious patients opt for other materials outside of amalgam. So I did some digging and searched on the FDA website to get more clarity on mercury toxicity in relation to amalgam fillings. And in 2021, they released a report that stated the following. Although the available evidence does not show that exposure to mercury from dental amalgam will lead to adverse health effects in the general population, exposure to mercury may pose a greater health risk in certain groups of people. They advise to not have amalgam fillings removed if they were in good condition with no signs of decay or tooth fracture. This is because if the filling is completely intact and healthy, then you would be putting yourself at risk for unnecessarily exposing yourself to mercury vapor. They also found that the majority of evidence shows exposure to mercury from dental amalgam does not lead to negative health effects in the general population. So if you're a patient and you've ever been told that you need a silver or amalgam filling and you're concerned about mercury exposure, here are some actionable tips. First, you can find a dentist who specializes in the removal of amalgam fillings. My good friend Dr. Kevin Chang in Austin, Texas is one of those docs. His practice is called Transcend Dental Health. You can find their information in the description below or do a simple search on Google. Other providers can also be found on the IAOMT website. IAOMT stands for the International Academy of Oral Medicine and Toxicology. Dentists on this site are more likely to be taking more serious measures when it comes to amalgam removals. Now, if you can't find a provider near you who specializes in this, don't worry. Your dentist is definitely equipped to handle this procedure for you. Now, if there's something wrong with your silver filling that you already have and you need it to be replaced or removed, just ask them to see if they're taking any special precaution when it comes to removing the silver filling. This way it gives them an opportunity to explain to you their protocol and help put you at ease. Again, for most people, you will be okay as the risk at this exposure level is very small. All right, let's talk directly to my fellow dental professionals. As dentists, there is a responsibility that you have to provide safe and effective care. Here are some practical solutions for you to implement to minimize mercury exposure in your practice. Let's talk about the SMART technique for safe amalgam removal. What does it stand for? Safe Mercury Amalgam Removal Technique. So the SMART protocol involves adhering to several safety measures to minimize exposure to mercury vapor and particulate matter. I'm going to read the protocol here based off the website. So protective gowns should be used for the dental personnel and patients. The room must be equipped with special special air filtering equipment. Rinsing with activated charcoal helps to remove any traces of mercury, and the team must collect the amalgam fragments with an amalgam separator for environmentally appropriate disposal. The patient will breathe oxygen through an external air supply, and during the procedure, teeth are isolated with a rubber dam and a high-speed vacuum, and a large vacuum of flushed water are also utilized. You should also be staying up to date with the latest advancements in dental materials that can help reduce the need for amalgams. I personally did not place any amalgams when I was practicing, as there are several alternatives today. There are so many innovations happening in dentistry, and it has allowed for alternative and safe measures to be taken for our patients. Speaking of innovation, if you want to learn about the fastest growing procedure in dentistry, I made this video and you need to check it out now.